Hello and welcome to the National University Heart Center, Singapore Cardiac Rehabilitation Programme. You have likely been discharged from the hospital recently after a cardiac event or procedure. What is cardiac rehabilitation and why is it important? Cardiac rehabilitation is a program designed to empower you with knowledge to improve your heart health after experiencing a heart event, as well as to integrate this knowledge into practice. In general, cardiac rehabilitation can be categorized into 3 phases: inpatient, outpatient, and post-program maintenance. Inpatient phase is the cardiac rehabilitation phase that is recommended to take place in the hospital early, after one's heart procedure or event. The goals of the inpatient phase include chest physiotherapy, early ambulation, and planning for a safe discharge back home. You will receive advice from a multidisciplinary team that includes dietitians, occupational therapists, pharmacists, medical social workers, nurses, and case managers on lifestyle modification towards recovery. You will also be taught how to start exercising at home safely. Outpatient phase involves an exercise program specially designed and personalized for patients after their discharge from the hospital. As part of this exercise program, aerobic and resistance exercises will be prescribed to improve cardiovascular fitness. Post-program maintenance phase is where participants use the knowledge learned from the outpatient phase to continue lifelong heart-healthy habits in the community. This can be done by either continuing independent exercise engagement or joining supervised exercise centers in the community, such as the Singapore Heart Foundation. A referral letter from an NUHCS physiotherapist will be required to join the Singapore Heart Foundation exercise program. The Singapore Heart Foundation is located at Bishan Junction 8, Bugis Fortune Center, and Bukit Gombak Sports Complex. At this point, you would have already completed your inpatient phase and will now be embarking on your outpatient phase. NUHCS offers a cardiac rehabilitation program for the supervised exercise outpatient phase of cardiac rehabilitation. The aim of this video is to give you an overview of this NUHCS cardiac rehabilitation program and help you understand the basics of exercise prescription. Introducing the NUHCS Cardiac Rehabilitation Program. This is a comprehensive and holistic program conducted by a team of multidisciplinary healthcare professionals. There are 6 main aspects to this program: behavior support, education, diet, exercise, smoking cessation advice, and pharmacological therapy. What can you expect from joining the NUHCS Cardiac Rehabilitation Program? Participants embarking on this outpatient NUHCS Cardiac Rehabilitation Program can expect to receive the following: a 1-to-1 initial assessment of your cardiovascular condition and fitness level, a tailored home exercise regime, and lastly, a 1-to-1 final assessment of your cardiovascular fitness, all of which will be conducted at the NUHCS Cardiac Rehabilitation Gym. During both the initial and final assessments, a physiotherapist will conduct a 6-minute walk test to determine your cardiovascular fitness and track your progress. 1-to-1 initial assessment. During the initial assessment, we will measure your height and weight. You will need to provide your personal particulars. You will update us on your current home exercise details. A 6-minute walk test will be conducted for you by the physiotherapist. A 6-minute walk test is a walking test that helps us to understand your current exercise capacity as well as to evaluate the body's response, in particular the heart and lungs, to exercise. We will set exercise goals with you. You will receive details of your exercise program. Any queries that you may have will be addressed by the physiotherapist or cardiac rehabilitation case manager. Lastly, you will need to make payment for the exercise program you will be joining. Home exercise regime. During your initial assessment session, your physiotherapist will prescribe a home exercise regime for you to do at home. This will be tailored based on your 6-minute walk test results. As a general rule of thumb, your exercise regime should start with a 10-minute warm-up, followed by aerobic and resistance exercises for 30 to 60 minutes, and end with a 10-minute cool down. Warm-up. Warm-ups are important to gradually increase your heart rate and prepare your body for the exercise. It is recommended to warm up for 5 to 10 minutes prior to your actual exercise session. Some forms of warm-up may include low-level aerobic exercises like marching on the spot or slow walking. You can also do some stretching to improve flexibility and minimize risk of muscle injuries. Moderate intensity aerobic exercises. Incorporating aerobic exercises into your exercise regime should be your primary focus after any cardiac event. Aerobic exercises concentrate on improving the efficiency of both your heart and lungs, thereby increasing your cardiovascular endurance and fitness. Brisk walking is a simple and safe form of aerobic exercise highly recommended for starters. It can be done anytime and anywhere, with no special equipment required. Other examples of moderate-intensity aerobic exercises include stationary cycling, arm pedaling, walking, and running. Moderate-intensity resistance exercises. Moderate-intensity resistance exercises include the use of free weights, resistance bands, or bodyweight exercises. These exercises help to maintain and improve muscle strength, balance, and mobility while preventing against frailty. When performing resistance exercises, it is important to breathe normally and exhale slowly upon exertion. Do not hold your breath when exerting. Resistance exercises can be done once every 2 days, and it is best to avoid them during periods of pain or inflammation. Cool down. End your exercise session with 5 to 10 minutes of cool-down movements. You can consider doing low-level aerobic exercises like slow marching on the spot or slow walking to gradually decrease your heart rate. After this, do some stretches to conclude the exercise session. Stretching after an exercise session helps flush out toxins which could have built up in your muscles after exercise. This reduces post-exercise muscle soreness. What are the factors you should consider when planning an exercise? Before you start exercising, there are some factors to consider. An easy way to remember your exercise prescription is to remember the FIT principle. F frequency, or how often you are supposed to exercise. For overall health-related benefits, it is recommended to exercise 3 to 5 times per week. I, intensity, or how difficult the exercise is. After a cardiac event, it is recommended to do moderate intensity exercises for health benefits. An appropriate moderate intensity exercise can be gauged based on 50% to 85% of your maximum heart rate, T-type, or what exercises you do. This could be either aerobic or resistance exercise, depending on the component of health-related fitness you want to improve. T, time, or how long you exercise for. You may engage in 30 to 60 minutes of exercise. This is excluding warm-up and cool-down timings. How much should I exercise for maximum benefits? If your target is to improve health and fitness, an cumulative aerobic exercise duration of 150 minutes per week is recommended. If your target is to prevent weight gain, 150 to 250 minutes per week of aerobic exercises is recommended. If your target is weight maintenance after weight loss, more than 200 minutes per week of aerobic exercises is recommended. Lastly, if your target is to lose weight, engage in more than 250 minutes of aerobic exercise per week. How to evaluate intensity of exercise? There are 2 ways to do so. 1. Measure your target heart rate with a heart rate monitoring device, and 2. Use of the Borg rating of perceived exertion scale. We would recommend you to measure your heart rate during exercise with a heart rate monitoring device. Do check in with your physiotherapist regarding your personalized moderate intensity target exercise heart rate range. Besides measuring your heart rate, the other method to subjectively evaluate exercise intensity is to use the Borg rating of perceived exertion scale, or RPE scale. The Borg rating of perceived exertion measures the intensity of physical activity. Perceived exertion is how hard you feel your body is working. The scale goes from 6 to 20, and you are recommended to remain in the green zone, also known as the target exertion zone. The recommended target exertion zone falls within the rating of 11 to 14. In this zone, you will be feeling some exertion and deeper breathing while exercising, but will still be able to have a conversation. If your breathing is comfortable or light, and you can sing a song without effort while exercising, your perceived exertion zone is now in the blue zone of 6 to 10. It is recommended for you to increase the intensity of your exercise if you are in the blue zone. If your breathing is getting forceful or uncomfortable, and you are no longer able to carry out any conversation while exercising, your perceived exertion zone is now in the orange or red zone of 15 to 20. It is recommended for you to scale back on the intensity of your exercise to keep within the target green zone and prevent overexhaustion. When is special care required during an exercise? After understanding how you should exercise for maximum benefits and the different ways to evaluate exercise intensity, it is also important to always practice care during your exercise. As a cardiac patient recovering from a heart event, it is important to know the signs and symptoms of a heart attack so that you can seek medical help promptly. Common signs and symptoms of a heart attack. Signs and symptoms of heart attack include chest pain or tightness, breathlessness, cold sweat, dizziness, nausea, or vomiting. If you experience any of the above symptoms, stop exercising immediately and rest. Check if the symptoms resolve or get better with rest. If symptoms persist, or if your pain level is 6 to 10 on the pain rating scale, please seek medical attention immediately. If you have been prescribed GTN, also known as glycerol trinitrate, bring it along with you wherever you go. Should you experience chest tightness or discomfort, please stop exercising immediately and consume your GTN. Special care for diabetic patients. Individuals with diabetes will need to monitor their blood sugar levels before and after exercise. Do not exercise if your blood sugar level is lower than 6 millimoles per liter or higher than 16 millimoles per liter. Hypoglycemia, or low blood sugar, may occur during exercise as blood sugar levels drop with exercise. Common symptoms of hypoglycemia include sweating, trembling, clammy skin, dizziness, excessive hunger, and generalized fatigue. It is recommended to bring along emergency carbohydrates such as sweets or cream crackers with you during exercise and consume them should you experience these symptoms. Also, remember to check your feet hygiene to make sure that there are no open wounds, as diabetes is linked to poor wound healing. What do you wish to achieve from this NUHCS Cardiac Rehabilitation Program? The NUHCS Cardiac Rehabilitation Program may be able to assist you in achieving your goals, for example, being able to walk or run with ease after a heart event, or be able to take part in a certain sport. Now, have a think about what you wish to achieve from this program. Setting goals has been widely shown to keep people focused. We would recommend you to plan your goals based on the SMART principle. Your goals should be: S, specific. What would you hope to accomplish? It could be an activity you would like to return back to, or it could also be something new you want to achieve. M, measurable. How will you know when you have met your goal? Use quantitative measures, for example, being able to walk 1 hour continuously by the end of this program. A, attainable. Is it possible to meet this goal with effort by your timeline? Consider whether the goal can be achieved in days, weeks, months, or even by the end of this program. R, relevant. Is this goal worth accomplishing? After a cardiac event, it's relevant to have a goal that forges healthy exercise habits and maintains a healthy lifestyle. T, timely. What is the deadline you set to meet your goal? Perhaps you want to be able to carry your grandchildren and play with them by the end of 3 months or by the end of this program. Lastly, remember to stay motivated, focused, and work towards your goal for good heart health. Please feel free to discuss your goals regularly with your physiotherapist. General tips before embarking on your NUHCS Cardiac Rehabilitation Program. How should you prepare for the NUHCS Cardiac Rehabilitation Program? Make sure you wear appropriate exercise attire and footwear. Avoid wearing slippers to prevent tripping and falling. Have your meals at least 1.5 hours before exercise, and medications at least half an hour before exercise. Drink enough water during the course of exercise. Avoid exercise if you are not feeling well. Call to inform and change your appointment if needed. Avoid vigorous exercise and consult the doctor or physiotherapist if unsure. What are the things to bring for the on-site cardiac rehabilitation program? In summary, you need to bring 3 items to the class. Number 1, your wearable device, if any, example, a smartwatch. Number 2, your GTN medications or asthmatic medications, if any. Number 3, your glucometer if you are diabetic. Handphones, headphones, and other personal devices should be kept in the lockers during the on-site exercise class. Wait till the red belt is released before you enter the class. The therapist might still be setting up the class for you. Discharge. Upon discharge from the NUHCS Cardiac Rehabilitation Program, you will be awarded a certificate of completion as well as a personalized home exercise program targeted towards achieving your goals. Finally, remember, it is never too late to start exercising. So, let's get started today. Do consult your physiotherapist if you have any questions regarding the contents of this video. We hope this video has provided you with a brief insight into the NUHCS Cardiac Rehabilitation Program, and we look forward to seeing you at your exercise class. Thank you.